In this module, we'll look at the recognition and management of major illnesses, including heart attack, stroke, epilepsy, diabetes, and asthma. A heart attack, or a myocardial infarction, is a serious condition in which the blood supply to the heart itself is blocked, usually by a blood clot. This is different to a cardiac arrest, in which the electrical system of the heart fails, causing abnormal heart rhythms, although many heart attacks will lead into sudden cardiac arrest. Now, the symptoms of a heart attack can vary greatly depending upon the severity of the heart attack. Let me just clarify that all heart attacks are a serious medical condition, but there is a range to this. Some of the classic heart attack symptoms that a casualty might describe to you are a vice-like crushing of the chest with the pain radiating outwards, often with the worst pain being down the left-hand side of the body. The skin becomes pale, cold and clammy, and they look ashen in colour. Rapid and shallow breathing leads to a feeling of extreme air hunger, where no matter what, you feel like you're not getting enough air into your lungs. All of these symptoms combine to give the casualty feelings of anxiety, fear, and an impending sense of doom. As a first aider, we should take any reports of chest pain within a casualty as serious. Many people may brush off the symptoms of a mild heart attack as indigestion or heartburn, but it is always best to err on the side of caution here. Of course, we should be carrying out our secondary survey, which will include asking the casualty questions about medical history, the last time that they ate, and any other pertinent information which may allow us to exclude certain causes of this sudden chest pain. In treating a heart attack, calm and reassure the casualty whilst helping them into a comfortable seated position, ideally on the floor in the W position. Call 999 or 112 for an ambulance and advise the casualty to chew 300 milligrams of aspirin so long as they are not allergic to it. This will help deal with the root cause, the blood clot, and should ease both the pain and severity of the heart attack. If the casualty has medication such as for angina, assist them in taking this and of course be prepared to resuscitate. It would be ideal to have an AED just in case, so it might be advisable to send someone to get this now as a precautionary measure. Asthma is a condition in which the airways narrow and swell and tend to produce extra mucus. This can cause a difficulty in breathing, particularly breathing out. Now, asthma is a very common condition affecting around 5.4 million people in the UK, according to studies carried out by the Asthma Society. That works out to be around 1 person in 12 will have asthma. There are different types of asthma, and what triggers an asthma attack in an individual can vary from person to person. There are certain triggers that are understandable, such as pollen, cigarette smoke, animal fur and dander, and pollution. However, asthma can also be affected by changes within the body, rather than external triggers. Hormonal changes, such as during puberty or menstruation, can trigger an asthma attack, as can elevated metabolic rates, for example caused by anxiety, exercise or stress. Whilst it is good to be familiar with these triggers, the individuals themselves should be familiar with their own condition and what triggers them. Asthma is managed and treated primarily through the use of inhalers. In the event of an asthma attack, we need to help the casualty in taking their reliever inhaler, which is usually blue. Help the person to sit up straight or in a position that they find comfortable, and allow them to use their inhaler every 30 to 60 seconds up to a maximum of 10 puffs. If this does not improve the condition, or they begin to feel worse, call 999 or 112 for an ambulance, stating that the casualty has asthma and their inhaler is not relieving the attack. As with any breathing issues, we should be ready to resuscitate if the casualty becomes unresponsive and stops breathing normally. A stroke is caused by a disruption in the blood supply to the brain. This can be caused through a blockage or a bleed, which means as first aiders we cannot do much other than manage the situation until the cause has been determined. The sooner a person receives treatment for a stroke, the less damage is likely to occur. There are a number of ways a stroke can present itself. The casualty may have weakness or numbness in the face, arms and legs, particularly on one side. They might become confused or struggle to understand other people or communicate with other people as the speech may slur. Vision in one or both eyes can be impaired, along with a sudden intense headache and dizziness, and a loss of balance can cause them to fall over. These symptoms are often summarised as the FAST test, which not only reminds us how to recognise a stroke, but what to do in the event of one. Face. Is the face drooping or noticeably different on one side to the other? Arms. Is there a weakness in the arms? Can they lift both arms to the same height? Speech. Can the person speak or is it slurred? And then time. After recognising these signs, it's time to call 999 or 112 for an ambulance, stating that you suspect a stroke. Epilepsy is a complicated condition, but in simple terms, it's a neurological disorder which is characterised by unprovoked seizures. Whilst there are over 40 different types of seizures, which use words that describe where the seizure begins and how it affects the body, for the purpose of this course, it will be simplified into two main categories, being minor seizures, such as absence seizures, and major seizures, meaning convulsive seizures. Minor seizures present as if the casualty is absent or becomes unresponsive to external stimuli. In many cases, it may appear as if the person is daydreaming, whilst a convulsive seizure will include the casualty becoming completely unresponsive, collapsing to the floor, and convulsing or shaking. If the casualty is having a minor seizure, guide them to safety and stay with them until they have fully recovered. Do not try to give them anything to drink or give them any medication. If the casualty is having a major seizure, we need to make the area safe by removing hazards that could injure them. Stay with them until they have stopped convulsing and carry out a primary survey and place them into the recovery position if they have not come around. The final medical condition we're going to look at is diabetes. This is a medical condition in which the body is unable to regulate the amount of sugar in the bloodstream. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is where the pancreas produces no insulin, the hormone which helps to regulate blood glucose, whilst type 2 diabetes is where the pancreas produces insufficient insulin. In both types of diabetes, an individual can suffer either a hypoglycemic or a hyperglycemic reaction. Hypoglycemia is where the blood sugar levels have dropped too low, whilst hyperglycemia is where the blood sugar level is too high. When the blood sugar level is too high, there are marked changes in the person's physiology. The casualty will very often be thirsty, as the body is craving fluids to dilute the sugar levels. The pulse is rapid and weak with rapid breathing. The skin tends to be flushed, dry and warm to the touch, and you can often smell the excess sugar in their body as their breath smells sweet and fruity due to the high levels of ketones within the body. This smell is similar to pear drops or nail varnish remover. To assist someone having a diabetic hyperglycemic episode, we need to encourage them to test their blood sugar level and take any corrective doses of insulin as prescribed by their doctor. If this is not possible, we must summon an ambulance as this can become a serious medical concern. When someone has too low a blood sugar level or hypoglycemia, the casualty is usually pale, cold and clammy. They can become very confused and even irritable, and their deterioration can be quite quick. Luckily here, the immediate first aid response is quite easy. Get some sugar into them. Sugary drinks such as fruit juice or sweets will boost the sugar levels temporarily, enough to perk the person up and bring them out of the danger zone. As if left untreated, low blood sugar levels may induce seizures. Once we have given the individual some sugary drinks or food, again we should encourage them to test their blood sugar level and follow any directions of their specialist consultant. In either instances, if there is not an improvement with the casualty within 10 to 15 minutes, you should call 999 or 112 for an ambulance. You have now reached the end of First Aid at Work on demand. If you haven't done so already, please ensure that you have booked onto one of our practical assessment days to complete the required practical elements for this course. We hope that you found this course informative and that it suited your needs. We welcome any feedback you might have and invite you to either email us or leave a review on Trustpilot. You can now download your end of course certificate, and thank you for choosing the Training Initiatives on demand training service.